Carolina. Mr. McHenry.
Well, Dr. Gruber, you know, as everyone knows, and as American people know, when the President said, if you like your plan, you can keep it, turns out it was the lie of the year, right? I mean, this is a very significant thing, and my constituents in North Carolina, and actually North Carolinians, according to the North Carolina Department of Insurance, 473,000 North Carolinians lost their health insurance because of Obamacare. So this is perplexing, right? You had a moment of clarity and honesty where you said, you know, it was a lack of transparency that helped pass Obamacare. And I concur, and I appreciate your honesty. I think it's horrific, though, that you participated in some level on obscuring the truth from the American people in order to pass this bill. Now, you apologize for that, and I thank you for that. And the American people hear you loud and clear. And as a sort of as a matter of morality, for you to apologize is really I know it's a tough thing to do publicly, but I thank you for doing that. So, you know, when I think about my constituents, though, did you think that there would be such a large number of folks that would lose their health insurance?
I don't know the exact number in North Carolina, but
well, it's 473,000 according to the Department of Insurance and the Raleigh News and Observer.
What I was focused on was the net increase in newly insured we've had under the law, which has been quite substantial.
Okay. So it's not relevant to your calculation that there would be people that would lose their health insurance?
That was part of the calculation.
It was. So there is churn, would you say?
There's always been churn in this market.
Sure. Did you think it would be such a large number that would lose their plans, though?
I don't recall the exact numbers I modeled, but we did model that some individuals would lose their existing plans and move to new forms of coverage.
Well, I think you anticipated, and you're obviously very well prepared. I think you anticipated this question. Is it similar or dissimilar to the number that you calculated?
I don't know of a national estimate of how many people have lost health insurance, so I don't know how it compares to what I projected.
So was there a discussion at senior levels in the White House and HHS about this potential loss of people's health insurance plans?
I don't recall whether they were when I was there. I can't speak what happened when I wasn't.
So was there was no moment of moral clarity, of honesty, that you came to publicly, that we now know about and most Americans know about? There was no discussion at the time that maybe we should put the brakes on this, that we're going to have a lot of people lose their health insurance plan, their preferred health insurance plan?
I was present for discussion. As I said, I provided numbers. I was present for discussion of those numbers and interpretation of what they meant in terms of how the law would affect individuals.
Did anyone say, well, pause for a moment. The President's been out saying, if you like your health insurance plan, you can keep it. Gosh, maybe we should tell him that that's not, in fact, the case. Maybe he should change his wording a little bit.
I was not in any discussion of presidential communication or messaging.
Okay. But in the meetings where you went through these numbers and you said to the administration, and look, you've got plenty of experience on this, you said to this administration, because you're in the employ of this administration, you said there will be people that lose their plans, right? Now, you said there are also going to be people that get other plans, right? But you said there will be people that lose their plans. Was this not registered? Did this fall in deaf ears?
All I know is what my modeling showed and what I conveyed.
And you conveyed that there would be, in fact, people that lose their preferred health insurance plan?
I conveyed that there would be churn in the market and some people would move to different insurance plans.
So as I said before, my interpretation of churn is that some lose and some gain. So when you have the President going out saying clearly, if you like your plan, you can keep it, it was in fact a lie, based off your numbers, based off the data you provided this administration. Is that correct?
I interpreted the President's statement as referring to the fact that the vast majority of Americans would be able to maintain their health insurance arrangements under the Affordable Care Act.
Okay. So you also said that, you know, the only way to pass this type of health insurance is to actually pay lip service to fundamental cost control, right? That you actually need to talk about cost control in order to pass this type of health insurance change. So was it, in fact, just lip service?
Fundamental cost control is very, very hard in health care. The Affordable Care Act does not solve the problem of high and rising health care costs in America.
It did pay lip service, though.
No, it did more than lip service. The Affordable Care Act is by far the most ambitious piece of legislation in our nation's history in terms of moving forward on cost control.
Okay. Okay. And so has it outperformed your model or underperformed your model?
My model, as with the Congressional Budget Office model, over the budget period did not
No, I'm saying so far.
So far, the law, in terms of health insurance coverage and other things, has matched fairly well with what the model predicted.
Okay. So that lip service was important, in fact, to pass it.
I don't understand the question.
Okay. Well, you said in order to pass it, you have to pay lip service to fundamental cost control.
As I've said, fundamental cost control is very difficult, but the Affordable Care Act takes all the first steps that are necessary to try to move us down that path.
Okay. My time has expired.
I thank the gentleman. I ask unanimous consent.